Hello friends, let us now learn about the clinical features of hepatitis B. We have already dealt with etiology of hepatitis B. So let us now learn about the clinical manifestations of hepatitis. So in the hepatitis, all clinical features can be divided mainly into three types. One, we have uncomplicated hepatitis. We have uncomplicated acute hepatitis. Second, we have subfulminant hepatitis. Subfulminant. Fulminant is within a very short time. If the disease progresses rapidly, then we call it fulminant. So, subfulminant or fulminant hepatic failure, where the patient symptoms progresses very rapidly in a very short interval. Chronic hepatitis. These are the three types of hepatitis. So we will deal each of them in detail. So first, uncomplicated acute hepatitis. In uncomplicated acute hepatitis, because it is acute hepatitis, the clinical features will resolve or recovery of clinical features is seen within 4 months. Within 4 months, recovery of clinical features will be seen, and 99% of hepatitis A falls under this uncomplicated hepatitis. So hepatitis A mostly resolves on its own by 4 months. It is an uncomplicated acute hepatitis. Then we have subfulminant or fulminant hepatitis. So in subfulminant or fulminant hepatitis, the patient will have first jaundice will be there, and slowly the jaundice will worsen, and as the jaundice worsens the patient will also develop coagulopathy. Why coagulopathy? See, most of the clotting factors which are responsible for coagulation, they are produced in the liver. So obviously, because the liver here in hepatitis, there is damage of the liver, so liver cells are not functioning properly. So as a result, the patient develops coagulopathy. There can be hepatic encephalopathy also. Why is there hepatic encephalopathy? It is because liver is a detoxifying organ. Actually, ammonia which is produced in our body, this gets converted into urea and is excreted in the liver. For that, we require enzymes of the liver. But if ammonia is not converted into urea and if it is not excreted, in such cases the ammonia level in our blood increases. So if it reaches the liver, then the patient will have um, hepatic encephalopathy features. So this subfulminant or fulminant hepatitis is actually most common in hepatitis B or drug toxicity. In both these cases, the patient will develop severe liver manifestations within a few hours. Within a short period of time. Within a short period of time, the patient's condition worsens. In subfulminant hepatic failure, we will also see it will also show hepatic necrosis is also present in these patients. Okay. Here also you will also see that there is loss of hepatic parenchyma is seen. If the loss of hepatic parenchyma, if the loss of hepatic parenchyma is more than 40%, in such cases, this will also lead to death of the patient. If the loss of hepatic parenchyma is more than 40%, then this might lead to death of the patient. So this is a subfulminant or fulminant hepatic failure. Then we also have one more type which is chronic hepatitis. In chronic hepatitis, the LFT changes which are present in liver in hepatitis like increased bilirubin, decreased albumin, SGOT, SGPT changes, all these, if they persist for more than 6 months, then then the patient can be called as chronic hepatitis. Chronic hepatitis, if you see the causes, this can occur due to viral causes or it can occur due to metabolic causes. And in the metabolic causes, we can either have Wilson's disease or there can be alpha 1 antitrypsin deficiency can be seen. There can be hemochromatosis also. So all these are most are the causes of viral causes of hepatitis. Similarly, there can be autoimmune conditions responsible for chronic hepatitis, or drug-induced conditions are also responsible for chronic hepatitis. So chronic hepatitis can occur due to viral causes or metabolic causes like Wilson's disease, alpha-1 antitrypsin, hemochromatosis, autoimmune causes or drug induced causes. So these are the common causes of um, acute hepatitis, I mean chronic hepatitis. Now, these are the types of hepatitis, that is uncomplicated acute hepatitis, subfulminant or fulminant hepatic failure, and in chronic hepatitis. First, we will see what are the features that you see in acute hepatitis, that too sonologically. First, before we go into sonological features of acute hepatitis, let us see the histology of acute hepatitis. In histology, actually, the hepatocytes, normally the hepatocytes are hexagonal in shape with a central nucleus. They look hexagonal like this. But in acute hepatitis, there is swelling of hepatocytes are seen. Number one, the hepatocytes are swollen and there will be sinusoids. These are the so first and foremost, the hepatocytes which are seen. In these hepatocytes, we see diffuse swelling of hepatocytes are seen. Number one, and we also have this is a sinusoid, and lining the sinusoid there will be proliferation of certain cells which are called as Kupffer cells. We have Kupffer cells which are proliferated, not lining the sinusoids. So proliferation of Kupffer cells is also seen in acute hepatitis, and these Kupffer cells will line the sinusoids. Okay, this is a sinusoid which is filled with blood. So these Kupffer cells are proliferated which are lining the sinusoids. And if you see, if this is the portal area, the portal triad. Okay, in this portal area, or actually around this portal area, we can see presence of lymphocytes, monocytes can occur around the portal area. So there will be infiltration of portal area can be seen by lymphocytes and monocytes. So this is the picture of acute hepatitis in histology. So this is the picture of histology of acute hepatitis. So in the histology of acute hepatitis, here the cells are swollen. If you see here, this is swollen cells. We'll also see normal liver, then we'll get a good understanding. So this is the normal liver. This is the liver in hepatitis. In hepatitis number one, if you see there is swelling of hepatocytes. So one, there is swelling of hepatocytes are seen. Okay, and these are the sinusoids. This is a sinusoid, and in the sinusoid we will see presence of increased proliferation or increased presence of Kupffer cells are seen in the sinusoids. That is number two. And you will also see here portal triad is not visible, but actually around the portal triad and all these, if you see, these are actually the lymphocytes. There is increased proliferation of lymphocytes and monocytes are seen in histology. This is the histology picture of acute hepatitis. Then if you see on ultrasonography, what do you see? On ultrasonography, obviously, see the whole liver. In the liver, the cells which should be in hexagonal shape, they become diffusely swollen. So as a result, the whole liver parenchyma will show decreased echogenicity. Number one, there is decreased echogenicity. Why? Because of swollen hepatocytes. All the swollen hepatocytes, because they are swollen, their structure has been changed. So as a result, there is increased hepatocytes. That is inside the liver cells or hepatocytes, there is increased water content. Obviously, water will decrease the echogenicity. So as a result, there is decreased echogenicity. That is number one. Number two, if you see portal triad, around the portal triad, there is infiltration of lymphocytes and monocytes. So these will increase the brightness of portal triads. So number two, there is increased or accentuated brightness of portal triad is seen, and this is also called as periportal. That is around the portal triad, you will see the cuffing is seen, accentuated brightness of portal triad or periportal cuffing is seen. Along with that, the uh, liver is increased in size, so we can see hepatomegaly. And similarly, here for the liver, we also have gallbladder. The wall of the gallbladder is also thickened. The wall of gallbladder is also thickened in acute hepatitis. So these are the main features of acute hepatitis. So if you see in the diagram, so number one, this is the liver, and in this picture you will see that there is decreased echogenicity of the liver. Number one. Number two, this is periportal, around the portal structures. There is periportal cuffing is seen around the portal structures. Okay, these two are number one. Periportal cuffing, that is accentuated or increased brightness of portal triads is seen. Obviously, you will see presence of hepatomegaly is seen. Right. And this is gallbladder. And this gallbladder, if you see, the wall of the gallbladder is thickened. So we will see that there is thickening of gallbladder wall is also seen in patients with acute hepatitis. So these are ultrasonographic pictures. You see a better picture. Yeah, this is more better. This is thickened gallbladder wall. These two are thickened gallbladder walls which are seen. So if you see here, this is actually a case of acute hepatitis. It's fever and liver function tests. So if you see, you can see decreased echogenicity in this, number one. Number two, even here you can see decreased echogenicity. And here the main thing is thickening of gallbladder wall is seen in this patient. Right. Next. The next important thing is, what about chronic hepatitis? If you see the patient changes in chronic hepatitis on ultrasonography, if you see the liver is completely normal most commonly. Most commonly, liver is found to be normal in patient with chronic hepatitis. But in the patient with chronic hepatitis, if cirrhosis develops, that is when we see the cirrhosis features, that is coarse or heterogeneous echo texture of liver is seen, along with surface irregularity is seen in patient with cirrhosis. So this is about the sonographic changes of liver in acute hepatitis. Thank you.